In this video, you'll get introduced to different types of therapeutic practices that we use for mental health treatment. First, I want to talk about the different types of mental health professionals that we encounter. These practitioners differ in their training and also in their therapeutic emphasis. First, we have a clinical psychologist. This individual will complete a doctoral degree in clinical psychology, and they provide therapy for people with mental disorders. A counseling psychologist has a different type of training. They'll usually complete a doctoral or a master's degree in psychological or educational psychology, and they counsel people with milder problems, so things having to do with academic or job struggles or relationship problems. A psychiatrist is someone with a medical degree, an MD, that completes a residency in mental health, and they provide therapy for people with mental disorders, and they also have the ability to prescribe drugs or biomedical treatments like shock therapy. The other practitioners on this list can't prescribe drugs. A psychoanalyst is any of the above these first three practitioners who has training in psychoanalysis, so in Freud's approach to unlocking unconscious thoughts. Finally, we see a clinical social worker, and this individual is going to have a master's or doctoral degree in social work, often with a counseling specialization. They're going to provide help to individuals with social problems, often emphasizing family problems and conflict. So these are some practitioners. There are others and others that are more specialized, but these are sort of some main categories of mental health practitioners. So therapists who work with patients on an ongoing basis will often implement a certain type of therapy or several types of therapy. So I'm going to talk through a few main types of therapy that we see in practice today. So the first type of therapy I'll talk about is psychoanalysis. And this is the therapeutic practice that was developed by Freud and based on his work of unlocking conscious thoughts. And the goal of this therapeutic practice is to unlock the unconscious thoughts of a patient. The therapist's role is to interpret these unconscious thoughts. There are a few unique methods that psychoanalysts use. One is free association. This is where patients are asked to say whatever comes to mind, no matter how trivial or repulsive. This is in an attempt to try to pick out pieces of the unconscious. Another method of psychoanalysis is dream recall, asking patients to recall the content of their dream, content that may reflect unconscious thoughts. This type of therapy depends on a strong working alliance, and this term represents a close partnership between the patient and therapist. The therapist needs to be able to interpret these thoughts, and that requires an established relationship. A second type of therapy is called cognitive therapy. In this type of therapy, the goal is to eliminate maladaptive thoughts. So basically, the therapist is trying to change the way the patient is thinking. The basis for this therapy is the idea that thoughts intervene between events or stimuli and emotional reactions. And the therapist tries to identify the thoughts and unrealistic beliefs that might be leading to maladaptive responses. So the therapist tries to help the patient change these thought processes, these thoughts that are between events and emotions. So let's talk through an example. At baseline, an individual might have experienced a job loss. Now this would be the event. This would lead to some internal belief or thought. Maybe the thought is, I'm worthless, it's hopeless, they just lost their job, they're feeling down. The outcome here would be depression. So we have an event, the lost job, an internal belief that leads to this outcome. After cognitive therapy, the goal would be to change this internal belief. So the same event, losing the job, would lead to a different thought process. Now the thought process might be, my boss is a jerk, I deserve better. And that different thought process leads to a different outcome, no depression. So the therapist tries to get this thought process to change in the patient. Changing these thoughts improves the outcome. And you see here, if we compare the two thoughts, the two internal beliefs for baseline and after therapy, we see that there's a change of attribution. And this should remind us of what we learned about when we talked about social psychology. A third type of therapy is behavioral therapy. And the goal of this type of therapy is to eliminate maladaptive behaviors. So with cognitive, we were looking at changing thoughts, and here with behavioral therapy, we're trying to change behaviors. There's little emphasis on the thought processes or reflecting on the past, for example. So with this type of therapy, the therapist applies principles of learning, tries to extinguish unwanted behaviors, and tries to get the patient to learn new desired behaviors. Often this is used to treat phobias and sexual disorders. Next up, we have cognitive behavioral therapy. And this type of therapy combines the cognitive therapy and the behavioral therapy approaches that we just talked about. So with cognitive behavioral therapy, or CBT, the goal is to uncover unhealthy patterns of thought and how they might be causing these self-destructive behaviors and beliefs. So this type of therapy takes a broad approach, and the therapist helps the patient explore the relationships between thoughts, feelings, and behaviors. So one example of CBT is exposure therapy. This is a form of CBT that's used to reduce fear and anxiety responses. And what this therapy entails is gradual exposure to a feared situation or an object, allowing the patient to learn to become less sensitive over time. So there's a behavioral component, but it's also supported by discussion of the thought processes involved. We see that this type of therapy, this exposure therapy, is particularly effective for obsessive compulsive disorders and phobias. There are some other types of therapy that we're not going to talk about in too much detail, but one of these is humanistic therapy. This focuses on a client's own self-perceptions rather than relying on a therapist's interpretations. This type of therapy emphasizes genuineness, acceptance, and empathy between the patient and the therapist, and this is a very client-centered practice. And then finally, I'll just mention family and systems therapy. This focuses on relationships and social interactions. Oftentimes, family therapists will bring in more than one individual, maybe a couple, for joint therapeutic sessions. So here we just talked about several different types of therapy, but one question is therapy even effective? We see quite variable outcomes across individuals, so this is a difficult question to answer. It's also very difficult to run controlled studies when it comes to therapy. Particularly, think about how you would try to come up with a double-blind study design in this case. So this is a difficult question, but I want to try to summarize what we think about therapeutic effectiveness with a chart. So here I'm going to draw an outcome chart, and on the y-axis we're going to look at frequency, and on the x-axis we're looking at outcome. So we're going from poor outcome to good outcome here. And if we look at people without therapy, so untreated individuals, we see a distribution of their outcomes. Some people have poor outcomes, some people have good outcomes. The vast majority of people are somewhere in between. And we can see the average untreated individual would fall at the middle of this curve here. And we say that therapy shifts this curve towards improved outcomes. So the blue curve is our untreated individuals, but now our red curve is going to be our treated individuals. And we see that on average, the curve moves to the right. Not everyone does better with treatment than without treatment, but this chart implies the average treated individual has a better outcome than about 80% of untreated individuals. So there are variable outcomes across individuals, but on average, we see evidence that therapy is effective. But why do we see variable outcomes across individuals? Why is therapy helpful for some but not for others? And so let's take an intercultural approach to look at this question. We can look at differences across racial ethnic groups to try to explore this question. One study looked at anxiety and the response to therapy of anxiety symptoms and found that religious individuals showed slower improvement in their symptoms than non-religious individuals. So we see that religion might affect the effectiveness of therapy. I want you to think about why this might be. We also see evidence that racial and ethnic minorities are less likely to receive care, and when they do receive care, they're more likely to receive inadequate or poor care. So we might see that racial and ethnic minorities might show reduced therapeutic effectiveness, but that might be due to access and quality of care concerns. So we do see differences between ethnic and cultural groups, and some of this might be due to access, and some of this might be due to stigma, but in any case, this evidence shows that therapists need to be aware of these cultural differences, and this speaks to the need for our therapists to develop cultural competency and culturally adapted interventions. A one-size-fits-all approach might not work. We need to adapt our approaches based on the identity of the individual we're working with. So this was just a brief introduction to therapy, some of the practitioners and some of the main types of therapy that we used as a part of a mental health treatment plan.